Gallbladder 20 is the point that sums up all the points on the head. All of the different viewpoints and all of the different calculations that go into living under oppression. You got to be a kind of calculator. How's this going to go over? How am I like this? And being able to see yourself being seen from how many different angles, that alone can cause internal wind. So gallbladder 20 is very important for creating the unification of viewpoints, like a giant fly eye. You know, the way they fly, it's like all these different eyes, but they're okay. They don't go batshit crazy the way that we can. It's such a relief of tension from that calculating and balancing, to be able to have a point of consuming perspective into a unified, okay. The head becomes ready to then come out of the head and onto the shoulders. Unfortunately, there may have been a lot that's come down on the shoulders. So gallbladder 21, my best translation of that point is should. The tyranny of should, that we may not even know that it's a tyranny anymore. We may not even know. But depending on what's been coming down from our head as we've been running our calculator, comes behaviors in our body. I need to be like this. I got to do that. And you know, that may in fact at certain points be the best choice, is to be like this or do like that. It may be the best choice in the moment under oppression. It becomes internalized depression when it locks into our shoulders like a down press, holding us in certain behaviors, in how we walk even when we're alone, and how tall we will stand. When we put in gallbladder 21 to free from internalized depression, we're starting to move into the gallbladder points that are around the heart. So it's not uncommon to also want to do some sort of upper CV point at that point. With each individual client, it's going to be different. But as we melt the should, we're actually wanting to say, hey, sweet one. Hey, beloved. In order to encourage the heart to expand, to take up the space that was under the rulership of should. Because it's really uncomfortable when the should loosens. Sometimes there's this feeling of, it's been so long, I don't even know what I would do. I've been adapting so long, I don't even know what would have come naturally. So we want to do an upper CV point, and we might want to do it with moxa, and we definitely want to do it with love. It's like, no, you're still there. You're still there. And you're so beautiful. Let the sun expand to take up that space. Might end up being more than one upper CV point. There's one that's like, this is where the love comes in. Gallbladder 22 and 23. They're kind of under the armpit area, like a little bit lower down. They're good for internalized oppression, including what happens to women from wearing a bra, especially if it's a little too tight. There you are, wild and free and 13 years old, and or whatever, age you were, and then they put you in a harness like a mule, like a, you know, and it can often create liver qi constraint. Though this can happen to men as well, and happen to anybody who's kind of not, I'm like, I'm going to hold my breath, because often the not saying it, not doing it, right, leads to a constricture of the rib cage as we don't say it, which may or may not actually be a great idea in the moment, but afterwards there's got to be a yeah. So if it's both the holding your breath not to say it, and it's the same muscles that go into punching somebody in the face or refraining from punching somebody in the, that was so rude, you know? Gallbladder 22, I nickname the hurricane. Frequently, there is something like a boxer's rain of blows in that point. Rage, which is why I often put in 23 either first or immediately after, because gallbladder 23, it's just like an inch away. Is a point that's all about acute awareness of the other. So we're both allowing the space for the rib cage to expand again, which there's usually rage in there, if that's why we've been holding it in, and awareness of impact on the other, so that we have the space. But again, we are free. We are not free if our impulses overcome us. We have enough space for freedom. Not always, but frequently, it's not a bad idea to be doing a CV point. It might be CV 13. Or something in the diaphragm area, because the diaphragm can get mighty tight as well. There have been, I'm thinking of two people, where we did this and their voice changed. Because they had an internalized depression voice. And that's how they were talking, and that's how they were holding their chest, and that's how they were moving their diaphragm. It was a keep it small voice. And with a CV point around the diaphragm and gallbladder 22, 23, their chest opened and their voice came out, not heedless, aware of impact, but taking up the space. I wouldn't mess with any of this without sources first. I wouldn't mess with any of this without probably doing sources first on its own treatment. Possibly also doing junctions and G-clefts as their own treatment. Because you want to give the person enough internal access to intimations of what freedom would be like. Waking that up and kind of getting the conversation started before making that opening. I will mention just a couple of other things. Sometimes, if there's an extraordinary amount of rage, you're going to use liver 2 instead of liver 3. That's kind of obvious, just to go clear it out. And sometimes, if there's really not enough rage, if you're like, why are you not angry? what's going on here? That's usually more about blood deficiency than liver qi constraint, where the person just has never developed enough of their own point of view and their own selfhood, because that would be inconvenient and lead to conflict, right? You'd have an opinion or something. For that, we're doing liver 1, gallbladder 1. And leaving that in a little bit while burning moxa wherever it feels like you're burning moxa, usually lower burner CV points, in order to help fill the person enough with their own experience and their own point of view that they can come to interactions as an equal from the inside. So make sure you schedule a next appointment, because they may come in pissed off. However, you now have a lot of possibilities of what you could do in that next appointment.